In the district of Gulu, northern Uganda, a victory celebration is underway. For 5 months, this community has been in a battle for its very survival against a silent, invisible enemy. Today they are celebrating the greatest of victories, the victory of life over death. Gulu is home to more than 300,000 people, most of them poor farmers from the Acholi tribe. Life here is unbearably hard. Almost half of the population is under 25. Few reach the age of 50. It is a fragile existence. 16 devastating years of conflict between the Lord's Resistance Army and government soldiers has taken its toll. Thousands of people have been forced from their farms and villages, seeking shelter from rebel attacks and displacement camps. The fighting disrupts food and medical supplies. There is the constant threat of turmoil. The conflict has left its mark on everyone and everything. Hardest hit are the area's 2 hospitals. The staff of 20 physicians and 100 nurses at Gulu Hospital make do with the limited supplies and resources. In the nearby village of Lachor, East Africa's most famous hospital, St. Mary's, struggles under the same pressures. Dr. Lucille Teasdale and husband, Dr. Piero Corti, spearheaded the building of St. Mary's into a modern medical facility upon their arrival from Canada in 1961. They also established a nursing school that graduates dozens of highly qualified nurses each year. Interns and graduates work alongside health professionals from around the world. Dr. Lucille passed on her passion for healing and caring for the sick, even if they could not afford treatment. Nurses work and live together in housing provided by the hospital. It's a tight-knit community. Dr. Lucille died tragically in 1996 from AIDS she contracted while performing surgery. She left behind a professional staff trained in the treatment and diagnosis of diseases like malaria, cholera, HIV, and tuberculosis. But what mysteriously appeared in September 2000 baffled everyone.
The last week of September, we started receiving patients who were not even improving. Even if you give them medicines or rehydrate them, they could only die.
Some of them had passing blood even through the mouth. They were coughing blood. So that was really so strange. I had never seen such a case in my life.
It looked a bit queer. And we did stool examinations, stool cultures, they were all negative. The blood cultures we would do would be negative, and these people would progress to die.
Cases multiply, and then 2 nursing students, Danielle and Christine, fall victim to the mysterious illness.
It was around midnight. Danielle died at night. For me, it was something shocking, not for the death, because you never get used to the death. But anyway, you know, you accept them. But it was the emotional reaction of the staff.
When she died, for us we thought, since the doctors also diagnosed that she had a peptic ulcer because of the bleeding, we thought it was peptic ulcer. again a student fell sick and had all the signs and symptoms the same with the one who died. From there, people started realizing there's something, some new strange disease.
The sudden deaths trigger an alarm. Dr. Yoti realizes a deadly outbreak is working its way through Gulu. He calls Dr. Matthew Lukwia, the medical superintendent of St. Mary's Hospital. But Dr. Matthew is 4 hours away in Kampala, the nation's capital.
That night, same night, he arrived together with him, went to review these students who were patients. That was on a Saturday. Then on a Sunday, we came to review also similar cases on the medical ward. There were about 3 other patients who were like that.
And then Dr. Matthew, he just went in medicine, where it was the ward where we were receiving this kind of patients, and just look at the medical form, at the chart of the patient. And there he tried to compare the symptomatology, and he understood that they were having all the same symptomatology.
Then he immediately that night informed the district authorities and the national authorities. He actually rang to the minister. You must have heard. And then, because of that concern, we started isolation ward.
Patients exhibiting the deadly symptoms are isolated in a separate ward. The source of the infection is still unknown. Doctors handpick nurses to work with them.
At that time, we had also a meeting with the matron and to try to, because the first group was not volunteer. It was just chosen one by me. You.
So you would choose?
Yeah.
How many did you choose?
5. 5 enrolled nurses and 5 nursing aides.
The first group of nurses go to work, but the essential protective gear is in short supply or missing.
We had no equipment. The first lot of people who started working in the isolation ward, there was no protectives. They could put on gloves. The mask on the face, on the nose, yes, they were putting. But anything to protect, say, your face, the whole face like this, protected, say, by covering other things like that, was not there. And in case a patient coughs into your face, everybody was exposed into a great danger.
And this danger provokes fear and confusion.
You are facing something that you don't know. Of course, you fear and you have plenty of questions. The people were dying like this in a few hours. So they were just coming to die because they were, at that time, nothing started. So they were just arriving in the hospital and dying in the hospital.
New patients are admitted daily. Dr. Matthew notifies the World Health Organization in Geneva for assistance and sends blood samples to South Africa for analysis. He then asks for volunteers to assist the first group of nurses.
No one was raising her hand. Then a sister who was working in the store raised her hand up. Then later on I said, but what brought me is to work with the patients, whether good or bad. And I'd been taught infectious diseases in the school. And it has never come here. Why not to nurse now? And I know it properly. Then I raised up my hand. And I told doctor, let me go and die with them.
On October 14th, 3 weeks after the first strange symptoms appeared, word arrives from South Africa. The blood has tested positive for the Ebola virus. People in Gulu are no strangers to hardship. They have withstood civil war and grinding poverty. Now they are confronted by the deadly threat of a highly contagious disease. The Acholi people are friendly, warm, and sociable. Physical contact and interaction are a part of daily life. Ideal conditions for a virus that spreads through human contact. Ideal conditions for Ebola.
Ebola is one of those diseases that is still very much a mystery, an enigma. We don't know where it lives when it's not infecting humans. We don't know how to treat it very well. We do know a little bit from the outbreaks that have happened before, but all of the unknowns make it a very frightening disease, but also a disease that has the potential to cause enormous damage.
What is known is that the Ebola virus moves quickly through the human body, attacking internal organs and soft tissues, which then bleed out of the body's openings. There is no cure or vaccine. It is highly contagious, surviving in blood, saliva, and other bodily fluids for more than 3 days. The last known outbreak in the Congo in 1996 claimed 245 lives in less than 4 months. Uganda has never reported an Ebola outbreak.
It was sad to see the patients die, but as either we had already been alerted that there's no way out. Once you have Ebola, you either die or survive. That is why we were scared, and we had to take extra precaution, because we knew after contracting the disease, it is either life or death.
The main concern is to keep the virus contained within Gulu. As more and more people arrive on the hospital's doorstep, the staff knows very little about how to treat the virus. The nurses are overwhelmed. They begin to fear for their own lives.
Everybody panicked because training of how to maintain those patients, especially to the nurses, was never done. Even during my course, I never learned how to protect myself against a disease like Ebola.
My first 4 days in Ebola ward was hard, simply because we were not having all those protectives, and patients were weak, bleeding, blood could come from their nose, their mouth, like that. So we suffered because there were no enough protective gears.
There were very many people who were vomiting, very many people were passing diarrhea with the blood, and others were passing diarrhea yellowish in color. The smell of the room was terrible. If you don't have a heart for nursing, you cannot reach it then.
The unthinkable is now routine. Any lapse in safety can be fatal. And yet, there are the patients. Weak, bleeding, crying out for help. Contact with them is unavoidable, but it can also be deadly.
The infectious area was really a very bad area, because practically you are walking on the virus, you are touching the virus, and anything you touch, the patient, the linens of the patient was full of the virus. So it was a very infectious and bad area.
The most dangerous part of the work was giving IV treatment. But when you are not careful, that is when you can contract the disease. The blood is like a bomb.
Despite safety precautions, the disease takes the life of one nurse every week. Morale in the hospital weakens. Sadness and uncertainty mingle with fear.
I felt bad because those nurses, we were working together. You also put on the same wares as they used to. You can only wonder. You may think that the next target will be you yourself. So that is the confusing part.
Those days when nurses used to die so frequent, I couldn't sleep in my room here without light on. In the darkness, I cannot sleep. I couldn't sleep, so I used to leave my light on until morning because I had that fear.
I was not really happy. And we were wondering why. But our suspicion was going that it was directed by touching, because you get the infection by touching. And in fact, according to me, I was thinking maybe workload, when you are very tired, sometimes you may not really keep the principle of what you are taught. You may forget in a fraction of a second, and with Ebola, a slight touch is just enough.
The virus spreads through the community. Over 100 patients now require constant care and attention. The small group of nurses are exhausted. No one else volunteers to work with them on the ward.
When we started working in Ebola unit, some of the staffs here refused to go and work, to volunteer, to go and work on those patients because the disease was already declared as Ebola, and it was deadly, as any other persons knew from here. So they said even if money, they are not going to work, to die because of money. So we who are working there, we went there because of money.
I thought of quitting the ward, but not quitting the profession, because many times we even approached Dr. Matthew, said, but doctor, don't you think it's nice to rotate the health workers so that you go and rest, you come back when you're free? But others didn't volunteer, they feared, they didn't want. And again, doctor said it's risky to bring somebody who has not got that experience, though it was not a formal experience, but experience on job. It was the best, because you know it yourself. Nobody tells you.
When Grace died, I was not willing to go to the hospital. In fact, I went 1 hour later, because I was... That day I refused. I said, I don't want to see anymore, because it is, you know, to see the patient, but the people that you were working just one day before, it's something is not so nice. I mean, it is. So the reaction has been this one for everybody, more or less.
Stories of dying nurses circulate throughout the district. News of the killer virus creates panic and hysteria. People mistakenly believe that the hospitals are the source of the outbreak.
Hospital in general became a fearful place, as if Ebola started from here. So the patients feared the hospital, and yet the other diseases were increasing, and the people were dying unattended to in the villages. Community deaths not related to Ebola became a bit common.
Whenever maybe the community is, one of the family members is sick at home, there will be fear also to bring them to the hospital, because they may think that the fella is coming to the hospital to get the disease and go back with at home.
As the death toll mounts, so do the duties of the nurses. The Ebola virus can survive in bodily fluids of the dead, so special precautions must be taken. A restricted burial site is established. Even in death, the Ebola virus is still a threat. The staff refuse to abandon their patients. And then comes news that help is on the way. News of the Ebola outbreak in Gulu has spread throughout northern Uganda. Suspected cases are reported hundreds of kilometers away.
Even the people in the villages were panicking. Some were not even welcoming whoever leaves Gulu and goes to the village. And at the same time, if there is Ebola within a family, that family was singled out, and people didn't want such a family to mix with them.
People linger outside the hospital, waiting for news of their loved ones. More than 30 patients have died and 2 more nurses have fallen sick. There is no end in sight.
It was hard when we were working in isolation, because we could recall our fellow staffs and nurses who died. Like if I entered a ward like this, if I faced east where Akulu Grace died, one of our staffs, I could see her as if she is coming in front of me. That was the fear I had.
I didn't know what to do, but I told my people, let's all go in the duty room and think first. Then we all came, because that time if we were to start doing anything, we are going to get contaminated there and there. So I brought everybody in the duty room. I withheld my tears. If I was to cry, things were going to be worse.
But for the doctors and nurses on the front line, help is on the way. The Global Alert Response Network, a task force comprised of health professionals from Europe and North America, arrives in Gulu. Equipped with an arsenal of modern medical equipment and supplies, their mission is to contain the spread of the virus and provide a measure of stability. Some fear it may already be too late.
When I heard that Ebola was breaking out in Uganda, my first concern was thinking about what had happened in 1996, which was in what's now the Democratic Republic of Congo, and how severe the outbreak was, the difficulties, the destitution of the people there, and the whole economic effects of the outbreak on that country. And it was very much a concern that it might become a large outbreak like that again.
A central laboratory is set up in St. Mary's Hospital. The Center for Disease Control oversees the operation. Blood samples from all incoming patients and field samples from the surrounding areas are screened. This facility runs around the clock, but it will take a total team effort to regain lost ground. Specialists from the World Health Organization train the nurses and provide them with new protectives and much-needed reassurance.
The special from Dr. Simon was very good, and it helped us a lot. And it is helping me up to now as I nurse my patients who have infectious diseases.
After the nurses receiving the training, they felt comfortable. They felt they were protected.
He told us that these people have been working in very dangerous conditions all over the world. Whenever there is an epidemic, they could move, go there and serve the people. But why didn't they die? So for us also, we were not going to die. That is what he told us.
Nurses in the hospitals find new strength, but misunderstanding in the community persists. Fewer people are voluntarily coming to the hospital for testing. Fear and suspicion are widespread. Instead of bringing them to the hospital, family members begin hiding loved ones suspected of having the virus.
People are very fearful of Ebola. They're fearful of anybody who has anything to do with it. And our first job is to try and find people to actually work and find people who might have Ebola. So it was quite a task to get people involved in trying to do something that would stop this outbreak rather than giving in to the fear in the community.
Public fear is countered by a mass education campaign. Volunteers are trained and sent out into the field. Their job is to identify potential cases and convince people that hiding infected relatives means placing every family member at risk. Without community trust, it will be impossible to contain the outbreak.
People were very much scared. If there was Ebola within the camps, it would spread like bushfire. What was done by the Ebola Task Force mobile team, we made the people aware that there is no shaking hands of your friends, even touching. Touching the hands was not there. No visit was allowed. Even if you have your son or what, you don't have to go to visit him. Stay in your place. The problem was with only the children, and we were trying our best to control, if possible, the children not to go, a child to move from one family to another family to meet. That one was also restricted, but with children you can't restrict. It's very difficult.
Time is running out. A media blitz is launched.
Well, the signs and symptoms of Ebola: severe illness with weakness and fatigue, fever more than 72 hours and less than 2 weeks.
Volunteers are sent to search for suspected cases in the remote villages and townships. But this is rebel country. The workers are putting themselves at great risk. Fear and suspicion are everywhere. Rumors of white people carrying a deadly virus circulate among the villages.
I can understand the fear that a lot of these people had, because if somebody went to the isolation ward and had Ebola, they had a very large chance of dying, and that in itself was hard for the community to accept.
Winning the trust of the frightened villagers is a long and hard process. The nurses are not immune to this fear. Ebola has followed them home and is tearing at the fabric of family life.
I would very much think of my daughter, because being a nurse in Ebola ward was so scary that many of the community didn't like us. They would run away from us, and that stopped me even from going to the market. I used not to go to the market. I would send my elder daughter to go to the market. I tried even to isolate myself, because I even feared infecting my people, my relatives outside where I was staying.
We thought our mother was going to give us Ebola, because she was working in the Ebola ward.
So were you scared?
Yeah, we were scared.
Margaret worries constantly about her youngest daughter, Innocent. At 2 years of age, she is unable to understand the danger. Margaret relies on her elder daughter to keep the family safe.
When I'm resting, she wants to be near me. And sometimes as she leaves her bed, and she asks me, "Mom, can I come and sleep with you?" But she was preventing her not to go and stay with me. She said, "Mom is having cholera on." Then she was able to run away. That's why I invented that word, cholera, and I was using it. And everybody in the home was using that. When she wants to come near me when I've just come from duty, that's what they tell her, and she will draw back.
The stress of being a nurse and a mother is considerable. Children are amongst the most vulnerable to a disease that spreads through human contact.
I told my daughter, Ebola is infectious. When she goes to school, she should not play with other children. She should not touch their saliva. She should not touch their... If any child is bleeding, she should run away. Because if she touches the bleeding of a patient, she would also get infected. And where there is a dead body, she should not go near.
By mid-November, over 80 victims are buried in the Ebola cemetery. Despite taking all precautions, nurses continue to die. No one understands why. Some start to blame the nurses themselves. The harshest critics will come from within the nursing community itself. The mysterious deaths of several nurses from the Ebola virus sows panic in the community. People shun the nurses in the markets and in their villages. Everyone suspects them of carrying the virus.
They were abusing us, the nurses, that we were careless. That is why we are dying. Because every week, we might even lost 2 nurses in a week. There was a day we lost 2 in a night. So people were saying, how really, if at all we were using the protectives? why should we die in a great number like that? But indeed, we were using the protectives in even the right way, but we don't know how we got infected.
When I go to buy things, they reluctantly welcome me. Others even refuse to give me what I want to buy from a shop. They refuse my money, something like that. So on the other side, it demoralizes me because it kind of gives me a feeling that my sacrifice, many didn't appreciate in the community, because they looked at me as somebody who carries infection, see? Not somebody who is working to prevent infection.
The strongest criticism comes from other nurses. Colleagues outside the Ebola ward accuse the nurses of not taking proper precautions. This tight-knit community begins to unravel.
Like when we were working here, from the other end we were being abused. You will be feeling of those insults. Here your friends are dying, you are also seeing that people are dying. So it was not an easy moment. Instead of supporting us, they were again demoralizing us. Instead of giving us courage, they were discouraging us.
The hospital is nearing a crisis. The Ebola nurses threaten to leave the ward. Dr. Matthew rallies his staff, reminding them of their duty to their patients and to each other.
Many times in our meeting, because we used to have frequent meeting in Ebola ward, and we told Dr. Matthew, please try to talk to the whole hospital staff, because their reaction towards us is changing, and it's not welcoming, it's not encouraging. We feel unfair, because what if their relative falls sick? What if they fall sick? What should be our reaction towards them? So we had many questions, but he said we forget about them, because they don't know what they wanted to do. They don't know what they're supposed to do. So we kind of kept working.
Now we wanted to quit, but we only remained there because of his word, the word of Dr. Matthew. We stood firm in it. So we could not now go away, and those who are dying are our fellow nurses, with whom we cannot leave them to suffer like that, seeing them dying like that. We had to assist them until the last moment.
You are heroes, those who are in this world. You are heroes, and you are going to be heroes. When you die, the Lord knows you are doing exactly the work He has sent you to do. People have sacrificed to come here, and you have sacrificed your life. Work heartedly, but I don't want you to get infection. I don't want to get infection. As for anything which is not there, we are ready to give you. And he became a hero among us. And we praise God for him.
To quell fears, Dr. Matthew initiates voluntary testing for all who work in the Ebola wards. Like battle-hardened soldiers, the nurses return to the ward. They work closely together, protecting and looking out for one another, standing by their patients to the very end.
We who are working in Ebola unit, we are one, because we knew that we are already isolated. So we had a common interest. We were one, always. From the ward, even from here, you could visit your friend, you go and enter the room, you chat, then you come away.
And this is Dr. Matthew, whom we were changing the bed with him. We were feeding the patients with him. Dr. Yoti was the one mopping the floor. No one was a doctor in this ward. No one was a registered nurse in this ward. No one was a nursing aide. Everybody was equal. And we were all having the same heart to work on the patient. This is why we really managed this Ebola to go. There was no differentiation. When you see your friend doing something, but you stop and you tell, there was no heart of jealousy among us.
Inspired by Dr. Matthew, the nurses regain confidence. By late November, new admissions to the Ebola wards declined significantly. The epidemic appears to be under control. Then, disaster strikes. At St. Mary's Hospital, 3 medical staff are stricken with the Ebola virus. Among them is Dr. Matthew.
He came here on Thursday morning. So on Friday, I was with him in his room because they said the senior nurses to stay with him. And I was alone with him in the afternoon. And then he told me a word and I knew he was going to die.
Nurse Stanley Babu also becomes infected and is placed in a private room beside Dr. Matthew.
Many times I would think of going to his room, but they say, no, don't go there. And I was hearing a lot of noise of oxygen cylinders, artificial respirators, and of many other instruments they were using to resuscitate him, and people walking with gumboots and so on. They made a lot of noise in the room, and they kept keeping me alert.
Through his last night, as he slips in and out of consciousness, Dr. Matthew continually reminds his staff of their mission.
He kept on emphasizing, encouraging us to work hard. And then secondly, he assured us that he is possibly going to be the last.
On the morning of December 5th, Dr. Matthew loses the battle against Ebola.
We thought it was the end of us all. We have lost a father to us, not only in the job, but particularly in isolation where he was working. Because this is a doctor who could advise us. He was the one who made us even to work there without any fear. So that seeing him dead, it was not an easy moment for us.
True to his word, Dr. Matthew is the last staff member to die from the Ebola virus. News of Dr. Matthew's death is carried by the international press. Word of his dedication to fighting the Ebola virus and protecting his people reaches many beyond Uganda's borders. The depth of loss quickly becomes apparent. Dr. Matthew's last request was to be buried next to his friend and mentor, Dr. Lucille, on the grounds of St. Mary's Hospital.
It was the Lord's call. And the words which he told at the last moment was touching. It was a touching word. He has been a fatherly man to us. His death is a shocking news to us. He has died. But I hope we shall meet in heaven. And I'm sure he's in heaven.
By the end of January, all suspected cases test negative for Ebola. New admissions dwindle. The hard work and sacrifice by the medical staff on the front lines has finally paid off. Dr. Matthew's words prove prophetic.
He kept telling us that if we'll end the epidemic, we'll celebrate together. But he emphasized the dead and alive would all celebrate together. So I keep remembering that all the time. When the day comes, I hope we shall remember together with him and celebrate the end of Ebola.
The countdown begins to Ebola-free day. The nursing staff and their families crave the return to normality, but first they must wait. If there are no confirmed cases of the disease for a period of 21 days, the outbreak will be considered over. In the villages and displacement camps, the situation is monitored closely. Field workers continue to search the countryside for possible cases. The World Health Organization has tentatively set Ebola-free Day for February 26th. Victory is close.
We felt more happier. We were only counting now the days towards the Ebola-free Uganda.
Uganda is declared Ebola-free on February 27th. Thousands gather at the local football stadium in Gulu to celebrate the victory.
Ebola-free Day, I was very excited because we knew we had fought the war and we had succeeded. You come in knowing that you're either going to survive or die. So it was like soldiers going to the front.
Well, since I was in the front line, holding the patients, feeding them, and then moving into the villages, taking blood from them, I think I deserve the distinction, the credit for it. Because I went to the battlefield and I'm talking. Can still eat beans, I can do everything there, see? So I feel happy.
It's a day of celebration, but also a day of mourning. At a service for victims in the Ebola cemetery, mothers and fathers, sons and daughters gathered to say goodbye to their loved ones and friends. More than 120 people are buried here. After the memorial service, the nurses gather at a small cemetery near Lachor Hospital to mourn their co-workers. At the grave of Dr. Matthew, colleagues and friends gathered to say goodbye. His heroism will be remembered forever. Six months after the first Ebola case, life is returning to normal. In the nursing school, students focus on their studies, preparing for midterm exams. The deaths of 12 nurses in the Ebola outbreak is more of an inspiration than a deterrent. For the nurses who served on the Ebola wards, the events of 2000 have strengthened their commitment to their patients and to their profession. This spirit of healing survives to this day.
I think my nursing has improved a lot. I've been telling my colleagues here that let us take the heart which we had in Ebola ward to those ones, because we are going in different wards now. We are not going to be together. So what we had in that ward, when you see your friend doing the wrong thing, please remind her.
Yeah, if Ebola comes back, I'll, I think, command the group, because I have the experience, I have the technical know-how, but I needed more of the theories of viral infection, particularly Ebola, so that I will coordinate my practical experience with the theories, and I will be able to help others to do the right thing the right way.
I learned that I'm courageous because I never quit the isolation ward. when the Ebola was there and people kept on dying. I didn't think of quitting. I worked.
And if Ebola comes back, you'll work again?
Maybe.